the most important thing to do is to isolate patients who are sick in the short term, and then in the long term is to really work on indoor air quality.
The Montreal General Hospital is experiencing a COVID-19 outbreak on its 18th floor as Quebec sees a rise in cases. According to the province's National Health Institute, the INSPQ, the COVID positivity rate in Quebec was roughly 15% last week compared to 2% in April. Dr. Christopher Labos says COVID-19 has still not gone away and is not to be taken lightly.
Most people have assumed that COVID is going to follow the same sort of pattern that we see with influenza and other respiratory viruses, that they'll surge in the winter and then go away in the summer. And COVID doesn't seem to do that. We do have summer waves. We do see more cases.
Experts say vacations and trips outside Quebec and Canada have led to new mutations of the virus and that the latest variant has caused more people to become infected once again.
We now know and have more fully appreciated that it is an airborne spread virus. Looking forward to not just our hospitals, but also our schools and our places of business. If we can improve indoor air quality, we will see less COVID and also less influenza and less other respiratory illnesses.
Since January, there have been 518 COVID-19 related deaths recorded in Quebec, with 22 occurring during the week of June 30th. Montrealers say at this point, the virus is simply part of life.
We learn with situations, and we know that if we protect ourselves, we protect others, everything should be well. So we shouldn't be scared, we should just be cautious.
We're going to live with it. People with a lower immune system will certainly be more affected, but now we have better living habits and we pay more attention to transmission.
A lot of friends are coming up with it. I have worked on the 18 and I had to get tested, which is never fun.
Am I going to get my 4th or 5th vaccine? Probably, if they recommend it. But aside from vaccine, I think the protection measures, washing hands, putting masks is what people should be doing.
We are very likely going to start treating COVID in the same way that we treat influenza, which is a different vaccine every year to better match the circulating strains. And so when the vaccines become available for both influenza and COVID-19, my recommendation is that people get both of them.
In Montreal, Anastasia Dextrene, City News.